Hi, my name is Victor Reyes, and in this slideshow presentation, I would like to talk about exercise addiction. What is process addiction? Addiction can occur in many forms. Often, it is assumed that physical dependence characterized by withdrawal symptoms is required in order for someone to be diagnosed with an addiction disorder. But the fact is that behavioral addiction can occur with all the negative consequences in a person's life, minus the physical issues faced by people who compulsively engage in drug and alcohol abuse. I like this picture that I chose in this slide because they describe some of these process addiction, like for example, in the right we have the person with doing trying to throwing back the food that he eat, like anorexia people, and then in the middle we have this lady with the addiction to the internet and the addiction to the to food to eat. Then the next slide in the center to the left, it shows represent those people addicted to social media. And finally in the left, I put two persons, a man and a woman, who are representing those people who are addicted to exercise. But why is process addiction bad? It is the compulsive nature of the behavior that is often indicative of a behavioral addiction or process addiction in an individual. The compulsion to continually engage in an activity or behavior despite the negative impact on the person's ability to remain mental and or physically healthy and functional in the home and community defines behavioral addiction. What I like in this picture that they put in this slide is that, as you can imagine, to get this type of muscle or this type of body, you're not only required to do many hours of exercise, but also to get in the use of artificial hormones or growth hormones to get this type of muscles. Also, the person might find the behavior rewarding psychologically or get a high while engaged in the activity, but may later feel guilty, remorse, or even overwhelmed by the consequences of that continuous choice. Unfortunately, it is common for all who struggle with addiction, people living with behavioral addiction are unable to stop engaging in the behavior for any length of time without treatment and intervention. Exercise addiction is a state characterized by a compulsive engagement in any form of physical exercise despite negative consequences. While regular exercise is generally a healthy activity, exercise addiction generally involves performing exercise amounts of exercise to the detriment of physical health. Spending too much time exercising to the detriment of personal and professional life, and exercising regardless of physical injury. It might also involve a state of dependence upon regular exercise, which involves the occurrence of severe withdrawal symptoms when the individual is unable to exercise. Differentiating between addictive and healthy exercise behaviors is difficult, but there are key factors in determining which category a person might fall into. Exercise addiction shows a high comorbidity with eating disorders. I decided to include these two pictures. The one on the top represents a person that it looks healthy, um, um, in contrast to the person on the bottom. People with addiction to exercise, they spend many hours on the gym. They lack on social interaction beside the people who they meet on the gym, and you can see the difference for the person on the top that is look normal. He's not getting that craving for big muscles, just trying to be healthy, and the one on the bottom is showing this attitude, like trying to be like a Superman that is shows on the t-shirt. The first article that I found is Exercise Addiction: Symptoms, Diagnosis, Epidemiology, and Etiology by Bersic et al. 2012. This article describes how regular physical activity plays a crucial role in health maintenance and disease prevention. However, excessive exercise has the potential to have adverse effects on both physical and mental health. Berserk et al. Offered a literature review on how present discussion of excessive physical activity focus on obsessive and compulsive exercising and use of several labels. The authors identify exercise addiction based on the following criteria that are modification of the DSM-4 criteria for substance dependence. Tolerance: increasing the amount of exercise in order to feel the desired effect, but in a buzz or sense of accomplishment. Withdrawal: in the absence of exercise, the person experiences negative effects such as anxiety, irritability, restlessness, and sleep problems. Lack of control: unsuccessful at attempts to reduce exercise level or cease exercising for a certain period of time. Intention effects: unable to stick to one's intended routine as evidenced by exceeding the amount of time devoted to exercise or consistently going beyond the intended amount. Time: a great deal of time is spent preparing for, engaging in, and recovering from exercise. Reduction in other activities: as a direct result of exercise, social, occupational, and/or recreational activities occur less often or are stopped. Continuance: continuing to exercise despite knowing that this activity is creating or exacerbating physical, psychological, and/or interpersonal problems. Second article that I found uh, is called Exercise Addiction in Team Sport and Individual Sport: Prevalence and Validation of the Exercise Addiction Inventory, and is doing by Liechtenstein et al. 2014. Exercise addiction is characterized by increasing exercise amounts which take priority over other areas of life. It is mostly observed in individual sports such as running and weightlifting, whereas addiction in a team sport has not previously been investigated. The aim of this study was to estimate the prevalence of exercise addiction in a team sport like football compared to an individual sport, for example, people who engage in fitness, and to test the psychometric properties of the exercise addiction inventory in the population. The exercise addiction inventory was completed by 274 men in the age group of 16 to 39 years, 98 football players, and 176 fitness exercisers. The authors compared the structure of the scale between the two groups by using structural equation models, and they found that exercise addiction can explain the 6 exercise addiction inventory variables. Thus, it is recommended for identification of addiction in both populations, but in football players, the idea of conflicts could be replaced. Motivation for exercise in the football group seemed to be enjoyment and competition, while the fitness group exercises for health and weight reasons. Compulsive disorders, as a type of anxiety disorders, are maintained primarily by negative reinforcements through anxiety reduction. Research shows that exercise addiction, like a compulsion, is maintained by its mood-altering effects. However, these effects extend beyond anxiety reduction to include listing other negative effects, including anger, depression, and boredom. Unlike compulsive behavior, addiction are also maintained by enhancement of positive effect. In the case of exercise, there are the mood improving effect of aerobic exercise and increased self-esteem as the result of maintaining a disciplined regimen or improving appearance. Muscle dysmorphia, an under-recognized form of body dysmorphic disorder, by Pope et al., 1997. In this psychiatric article, the authors describe how their literature review they found several ongoing studies describing the consequences of exercise addiction. Pope et al. Have encountered men and women who display a form of body dysmorphic disorder in which they become pathologically preoccupied with their degree of muscularity. This condition, which the authors have tentatively termed muscle dysmorphia, may cause severe subjective distress, impaired social and occupational functioning, and abuse of anabolic steroids and other substances. I like these pictures on the left because to these people who have suffering from body dysmorphic disorder, the body is something that they needed, that they want to look in some certain way, and for some of them, the price to pay for that the look of their body is very high. Pope et al. Have argued that exercise addiction is always secondary to an eating disorder. In a questionnaire distributed by 194 women, they were unable to differentiate exercise addiction from eating disorder. In the absence of an eating disorder, participant exercise did not create the level of distress normally associated with an addiction. However, they focused solely on excessive exercise, which fails to take into account the criteria unique to an addiction, such as withdrawal and tolerance. When exercise addiction and eating disorders occur, the danger is that only one problem will be treated. Often the eating disorder, as the better known disorders, is the focus of treatment and the secondary exercise addiction remains hidden. Despite the improved relationship to food, the patient still does not gain weight, which is managed through an increase in the exercise regimen. Psychometric properties and concurrent validity of the two exercise addiction measurements. A population-wide study by Monaca, 2015. Exercise addiction has been described as a morbid pattern of behavior in which the habitually exercising individual loses control over his or her exercise habits and acts compulsively, exhibit dependence, and experience negative consequences to health, as well as his or her social and professional life. It is different from exaggerated exercise present in various eating disorders, also known as secondary exercise addiction, in which the behavior represents a means of weight loss rather than addiction. The negative consequences experienced are the key factors that separate healthy from unhealthy patterns of exercise. In addition to body injuries and re-injuries due to exaggerated amounts of exercise without proper rest and recuperation, social and psychological hardship is also evident in exercise addiction. As you can see in this picture, the little mouse is doing exercise in the mousetrap, which in this case I like to put it there because illustrate how person with this exercise addiction, they get also their body and their self in risk this risk behavior. The inability to sleep and concentrate, a sense of restlessness, and painful withdrawal symptoms similar to substance abuse are also daily manifestations in exercise addiction. These negative consequences are so severe that they interfere with the normal daily functioning of the individual. Therefore, exercise addiction is serious psychological morbidity that should be understood and recognized by clinicians and prevented wherever is possible. Um, as you can see in this picture that I put in this slide, it's because for some people who suffer from muscle dysmorphia, that's the way they see themselves. They see themselves like as a child, like there is never enough. The big muscles they needed to feel better, and also because some kids, as you can see it on YouTube videos, they start at very early age to get this addiction to exercise and trying to have a man-like bodies when they are just little kids. Christian understanding of the process addiction. In the Christian perspective, we can help those who suffer from exercise addiction to change their goals of perfection and instead be perfect as Jesus is perfect. This verse from the Bible in Ephesians 4:13 to 15, it says the following: to equip the saints for works of ministry, to build up the body of Christ, until we all reach unity in the faith and in the knowledge of the Son of God, as we mature to the full measure of the stature of Christ. Then we will no longer be infants, tossed about by the waves and carried around by every wind of teaching and by the clever cunning of men and their deceitful scheming. As therapists, we can encourage our clients to take care of their body because they are the temple of the Holy Spirit, and to remember that this body will disappear. Why invest all of our energy in a body that it will be destroyed, when it's better to build up our eternal body, as suggested by the Apostle St. Paul?